The greatest heart drug ever developed, ever developed. I'm Dr. Evan Levine, board certified cardiologist. If you enjoy my videos, please like, share, and follow. And don't forget, send me your cat photos and I'll post them. Love the cats. Spironolactone was marketed over 65 years ago, cost about $10 a month. Greatest reduction ever in mortality for heart failure patients. That's a 30% decrease in death. Now that's unheard of. And if you know p-values, the p-value was 0.001. That's a better outcome than a $20,000 plus defibrillator. But are you taking this? Have difficulty in controlling hypertension? Well, nothing's better than adding, guess what? Spironolactone. Spilling protein in the urine? Spironolactone will help. Women, thinning hair, or some acne, spironolactone will help. Now, there was a government-funded study, and I'll link to this. The NIH looked at a new type of heart failure. It's not new, but we didn't know much about it 20 years ago, and it's called heart failure with preserved ejection fraction. The heart function's normal, HFpEF. And we see that a lot in the elderly. A trial called TopCat. They farmed this out to hospitals in North America, but also, I guess, to save money, Russia and Soviet Georgia. A big pharma would have never done this. Government wants to save money. Yep, big pharma would never have done this. But Soviet Georgia and Russia, one of the most honest and trusted governments in the world, and the results were negative. No improvement versus placebo. But weird stuff kept popping up, like very few in Russia and Georgia had adverse effects like high potassium, which the drug could cause. And when they checked the bloods in these people, many of them didn't have the metabolite of the medication in their blood. There were even people talking about selling it on the street. So it appears that many of these people, well, they probably weren't taking the drug. Got it? When they looked at the results, when they removed the Russians and Soviets, the Georgians, there was a positive effect. The drug worked. There you have it. Spironolactone. What's the cost of that drug? About $10 a month. It reduces hospitalizations and mortality, as we spoke about. Are you taking that drug if you have heart failure? Maybe you should. Have a discussion with your physician, and I hope that helps.